Good evening, everyone, and welcome to today's 18th Maha Smiles Cleft Care for Every Child webinar. So, we are honored to have all here as we explore an important topic that affects countless children globally, cleft lip and palate. So, you all will agree that cleft lip and palate are congenital that occur when a child's lip or the roof of the mouth doesn't form properly during the pregnancy. So these conditions can lead to various challenges, both physically and emotionally, for the affected children and their families. So, as gynecologists, it's crucial to have a deep understanding of these conditions, the impact they have on children, and the available support systems to help them lead healthy and fulfilling lives. So, today we will discuss how Smile as an organization has been spearheading a unique initiative around cleft lip and palate along with AMOX. So, just to give you a quick glimpse, about Smile. So, is my screen visible?
Yes, Harsha.
So, Smile is a global organization that provides free life-changing surgery and comprehensive care to children, both born with clefts. Their efforts go beyond surgery by offering essential services such as speech therapy, nutrition, and dental care, ensuring that children with clefts receive the holistic care they deserve. On the other hand, AMOX, the Association of Maharashtra Obstetrics and Gynecology Society, plays a crucial role in supporting healthcare providers by promoting awareness and educating medical professionals on the importance of early diagnosis and intervention for cleft lip and palate. So, Maha Smiles is a CSR collaboration between Bajaj Finserv and Smile Train India. So, this partnership aims to build awareness and support the treatment of children with clefts in Maharashtra. Through Maha Smiles, nearly 8,000 life transforming cleft surgeries will be provided to children in need in Maharashtra over a period of 36 months. So, this initiative focuses on creating awareness among the importance of timely treatment and the critical timelines for cleft care. So, in line with these efforts, the webinar series with AMOX and Science Integra aims to facilitate the resources and the educational support within the AMOX community regarding the diagnosis and timelines of cleft care. So, build linkages between AMOX members and Smile Train treatment centers, ensuring that the children in need and expecting parents receive the prudent and timely help. So, throughout today's session, we will explore how these organizations are working together, provide comprehensive, life changing care for children with clefts, and how you, as gynecologists, can play a pivotal role in early detection, counseling, and connecting families to the right healthcare teams. So, we are excited for today's discussion ahead and look forward to a productive session. Without further ado, let's get started. Over to you, Sheila Koina, ma'am.
Thank you, Harsha. I'll just share my screen. Is my screen visible to all?
Ma'am, it is visible, but can we finish with the inauguration of the webinar first?
Yes, of course, please.
Yes, ma'am. Thank you.
Go ahead.
Harsha, can we have the prayer song before we start with our webinar? We want to take blessings of the Lord Almighty. And we wish to inform you that we are in the 18th episode of this Maha Smile webinars. And we would like to thank Dr. Kiran Kurti, sir, the president of AMOX, who has always given us a free hand to all the activities that we are undertaking. And in the last year, Dr. Rashmi Kahar Madam was the convener, and this year I and Dr. Supriya Arwari Madam are the conveners. So this is the 6th episode in this year, and last year we had done 12. So can we have Dr. Kiran Kurti sir's slide after the prayer song so that I can introduce him briefly and we can take his blessings?
Yes, ma'am. Yes.
Harsha, the prayer song first.
Alaikum.
Good evening, madam.
Good evening.
So, ma'am, which prayer song would you like to play?
Okay, if you've not taken, it's okay. Can we show Dr. Kiran sir's slides? Sir is currently the president of the AMOX Association. He has been a very supportive leader for all of us as chairpersons and zonal coordinators. He's given us a very free hand. Sir has been the chairperson of the MTP committee, Foxy. We welcome you, sir, for your blessings today for this webinar.
Thank you. You can
Kiran sir, yes, sir.
take out that slide. Thank you so much. Thank you so much.
Stop sharing, Harsha.
Yeah. So rather than me giving any blessings, I really feel blessed that we are a part. Amox is a part of this very nice CSR, which is between two very eminent bodies. We have the Smile Train, and along with that, Bajaj Finserv. So these are very two respectable bodies, and I think Amox is really blessed that they thought that Amox would be a good partner to take up this the proceeds further. So really, thank you for that. Thank you, Sheila Madam, and I'm really happy to note that our target is around 8,000 surgeries over a span of 36 months. That's really a huge achievement. Well, I would like to congratulate Dr. Monica, Dr. Supriya, today's MOC, Dr. Preeti, and everyone, because you have been consistent enough. This is my 18th episodes, and every time I have to see what new to say. So it's such a huge work that you're doing, and I really appreciate, because you have brought on the platform various people from all fields. Like we have brought, you have got gynecologists, obstetricians, fetal medicine consultants, dental surgeons, maxillofacial surgeons, plastic surgeons, counselors. So it's a very, I mean, when we think of cleft palate, cleft lip or palate, we only see whether the nose bridge is formed, whether the nose skin is there, whether the equal to sign is there. So our thought process is limited to that. But the work which goes behind that, and more work which goes if these conditions are not diagnosed, and what about the children who are born with this condition, how to take care of them. So that work is really phenomenal. So I would like to congratulate everyone on that, and I welcome on the forum Dr. Vidya, my sister in Foxy, and of course Bharti Ambedkar whenever Bharti joins, because Kasoga, Vidya, everyone are close associates of Amox, and they have been always supporting Amox in whatever activity we do, and we reciprocate the same for the Kasogas. So thank you so much. My short, I would not say blessings, but I would say Thanksgiving, you can say, to Science Integra also, and to Smile Train, and to Bajaj Finserv. Thank you so much.
Thank you, sir. It's always an honor to have you with us today. I would now like to introduce Dr. Vidya Thobi, madam, our guest of honor for today. Madam is the Vice President-elect for the next year. She has been the immediate past President of Kasova. She is also the professor and former head of the Department of the Amin Medical College at Vijapur. She is also on the Board of State Advisory PCPNDT Karnataka and the ICUG Governing Council member for the year 23 to 25. She has received the Best Committee Foxy Award, Dr. Meru Hansotia Award in 2020. We welcome you, ma'am, and it's an honor to have you with us today. And the main purpose for inviting us you today was that we wanted to integrate the Smile Train with the Kasoga also. So we would like to have Smile Train webinars in Karnataka state as well, ma'am.
Yes. Thank you, Dr. Monica and Amox, for bringing me into picture here. And I always appreciate to be associated with Amox, because I always tell Dr. Kiran also that is my first only, the Mahe of mine. So always it is a pleasure to talk on Amox platform. I heartily congratulate Dr. Kiran. He is a visionary leader. And I'm just looking at how much he has incorporated various certificate courses, as well as the Maharashtra College of Obstetrics and Gynecology he has brought in, and so many activities he does with so much zeal, enthusiasm, and energy. I heartily congratulate Dr. Kiran about it. And of course, Dr. Monica, I'm observing you and your activities, Dr. Supriya and Dr. Preeti, in the past and in the present also. And this activity is also very much appreciable. The smile train does exist in Karnataka. But of course, it is with the dental surgeon. And as Dr. Kiran has incorporated in AMOGS, and I feel that obstetrician and gynecologist also should know about this smile train. And they should, as you have taken today's scientific program, highly appreciable program, that one topic is regarding difficulties in the diagnosis of cleft lip and palate on ultrasound. That is very important. Many times we face the challenges of these cleft palate and cleft lip, which are not diagnosed on ultrasound, and we face the medical legal problems also. That is a very important topic. And the second one is beyond surgery. So beyond surgery, this is another important topic which will be talked by today's talk is by Dr. Renu Mehta. So these two topics really are very useful, and I will take up this with Kasoka, and we will just I will talk with Dr. Bharti today, and we will just take up this smile train ahead in Karnataka with Kasoka. I have already heard about this smile train, and I have referred for this smile train with the dental surgeons or maxillofacial surgeons. They refer the cases and they do operate in Karnataka. But this is very great program which is incorporated with the obstetricians and gynecologists, and I heartily congratulate you, Supriya, as well as Preeti Vyas on this venture. And I always feel that you also should come up in Foxy, and I wish all the three of you very best. Thank you very much, Amos. Thank you, Dr. Kiran, and the whole team today who are participating. I will take all the names of chairpersons and speakers. I would definitely listen to the topics, and really thank you very much for the inviting for this important webinar. Thank you. Thank you, Monica.
Thank you so much, ma'am, for
Thank
the
you,
kind
Vidya ma'am.
words. Really sweet of you.
Thank you,
And
ma'am.
it's such a pleasure to be associated with Kasoga. We can further spread more and more smiles.
Yes,
And at
yes.
the outset, I would also like to personally thank Dr. Kiran Kurtakoti for, roping in AMOGs in such an important
Yes,
aspect of
yes.
cleft lip, not only the anatomical and surgical nuances, but also rehabilitation, feeding,
Very
breastfeeding,
important,
so
very
many
important.
things we are undertaking as a part of Smile Train, and now we are on Maha Smiles, so with the smiles are becoming bigger and broader. Thank you so much, ma'am, for your kind words. And now I would
Yes,
again
thank
like
you.
to invite the guest of honor for today, Dr. Bharti Abhyankar. Can we have Bharti ma'am's CV slide, please? Bharti ma'am, of course, is not
Ah,
someone whom is not known in AMOGS. Everybody is very familiar with her. She is the Vice President, AMOGS 24-26, Executive Member of ISCCP, Organizing Chair of ICCP Con 2025, and has worked on various committees of Foxy, AMOGS, and is a very, very, passionate teacher, passionate academician. Madam, your words of wisdom are
thank you,
always
Supriya.
welcome.
Thank you
So,
for
may
the
I hand
kind
over to
words.
you?
Yeah, thank you. Thank you so much for the kind words, Supriya. Good afternoon and sorry for being late. But my best wishes are always there with all the trio. You, Monica, you all are working very nicely. And our president, Dr. Kiran Kurtakoti, यांच्या पोतडीतून तर इतक्या आयडियाज निघत आहेत की पुढच्या लोकांसाठी खूप अवघड काम ते करून ठेवत आहेत की त्यांचा आदर्श डोळ्यापुढे ठेवून आम्हाला हे काम करायला पाहिजे. So the Smile Train itself is a very nice project. In Kolhapur, usually the plastic surgeons, they run this train. But I'm very happy that AMOX has included this, and my best wishes are always there. Thank you so much for involving. Thank you.
Thank you, ma'am.
Thank you, Bharti
And,
ma'am. It's an honor to have you with us and sharing the same platform with you.
Thank you.
and also, we would like to thank the Smile Train technical team. I can see Shaila ma'am and Harsha are joined. Charvi is there. So all this team is, relentlessly working hard towards making Smile Train a big success. So Monica, now can we hand over to our
Yes.
cute MOC for
Yeah,
today,
MOC.
Dr. Preeti Vyas?
So I would like to thank Preeti, who has accepted to be the master of ceremony for this webinar, and I would request you to please introduce our chairpersons, Dr. Lalita Madam, Dr. Jitendra Sir, and Dr. Sachin Khedkar Sir for the sessions first. And I would like to thank Dr. Pratna for accepting our invitation to speak about difficulties in diagnosis of cleft lip and cleft palate on ultrasound. Wishing you all the very best, Preeti, and we can start with the webinar.
Thank you so much, Monica and Supriya both. And thank you, Kiran Kotikoti sir, as well as Bharti madam, Vidya madam, for being a part of this prestigious webinar series that we have. The Smile series is something that's very unique, and I think we need to reach out not just to Amox and Kasoga, but the entire Foxy. And I'm sure Monica, once she becomes the Foxy chairperson of PAC, that's going to be a cakewalk for her. So all the best to Monica and all the best to Supriya, my darling. Okay, so can you please display the slides? I would like to now request
Harsha?
persons for today. We have with us
Lalita Madam, slide, please.
we have with us Dr. Bharat Lanjevar sir. Dr. Bharat Lanjevar sir is the president of Bandara OBGYN Society, a consultant at the and an infertility specialist at the Sayog Hospital and Test Center at Bandara, and is also a faculty at the MBBS workshop at Kolhapur. Next slide, please. Welcome, sir. Dr. Jitendra Gumare, sir. Dr. Jitendra Gumare is the president of the Dhule OBGYN Society. He's a consultant OBGYN at Shankambari Hospital and an associate professor at the Government Medical College at Dhule. We also have Supriya, you need to Supriya.
Supriya ma'am, can you mute yourself, please?
I'm sorry.
Yeah.
Yes, ma'am.
The third chairperson. Welcome, Dr. Jitendra. We also have with us Dr. Sachin Khedkar. Dr. Sachin Khedkar is the secretary of OBGYN Society of Chalisgaon. He's also this is not seen better. You can't keep
Sachin sir, slide, please.
Sachin sir, slide. Megha.
Harsha.
So Dr. Sachin Khedkar is a consultant at Chalisgaon, and he's the secretary of the Chalisgaon OBGYN Society. So we like to welcome all our chairpersons and the esteemed faculty for today. Sir, can I please request you all to introduce our first speaker for today, Dr. Pratna Shah. She will be talking on difficulties in diagnosis of cleft lip and cleft palate on ultrasound. Thank you, sir. Harsha?
Jitendra sir, and Sachin sir. Yes, sir.
Yes, ma'am.
Yeah. Harsha, can you show Dr. Pratna's slide, please?
Sure.
Bharat sir will be joining us a little late, sir. So I request Jitendra sir to please request Dr. Pratna Shah, introduce her.
Harsha?
Hello.
Jitendra sir, you need to unmute yourself. Yeah. Now it is visible. Please make it in a slideshow format, no? Full screen. Yeah. Sir, please unmute yourself to introduce the speaker.
Yes.
Yes.
Hello.
Sir, you're audible now.
Yeah. Dr. Pratna Shah, she is consultant maternal fetal medicine working at Sambhajinagar. She is specialist in high risk obstetric and fetal medicines. She is having 12 years experience in this field. And she is the first maternal fetal medicine consultant in till now she has successfully completed 1,500 fetal invasive procedures. She has presented a lot of papers, posters in various conferences. She's being health IMA. So I will like to request Shah Madam to start with her lecture.
Am I audible, sir?
Yes, you are.
At the outset, I would
Yes,
like to
yes, ma'am.
thank our
Yes.
President Kurtakoti sir, Vidya Thobi ma'am, Supriya Arwari ma'am, and my dear friend Monica for giving this opportunity for the talk. So the topic is difficulties in cleft lip and cleft palate evaluation in the fetus. So I'm not going to restrict just to difficulties because that is not what we are here to learn. We are here to learn as how we're going to bypass those difficulties and going to achieve what exactly we want to do as a fetal medicine consultant. So the outline is going to be why exactly we want to evaluate these conditions for, when we are going to evaluate what is the ideal gestational age, and how exactly we are going to bypass those difficulties in evaluation. We know about the prevalence, and the incidence is more common in male than female, and it's more common on the.
Pratna,
Yes, ma'am.
Pratna, you need to start sharing your screen because it's only you that is visible. Your
Oh,
screen
sorry,
is not
sorry.
visible.
Sorry, ma'am. Just a second. No?
Yeah.
Is it visible now?
Yeah, you have to make it full screen and
Yeah.
it's
Yes. That's fine.
It's not full screen as of yet.
This is my full screen on my laptop.
It's the slides are visible. You can start moving the slides. It's fine as long as we can see it.
Okay, fine. So, as I told, we are going to discuss why we are going to evaluate for this particular cleft lip and cleft palate in the fetus, when exactly, whether in first trimester or second trimester, and how we are going to bypass those difficulties that we are going to encounter. The prevalence we know is around 700 births and more common in male as compared to female, and it's more common on the left side. Now, whenever we talk about cleft lip and cleft palate, we need to understand that these two are different entities. Isolated cleft lip only 25% of the cases, but the isolated cleft palate is 25% and a combined is around 50%. So there is a around.
Pratna, your slides are not moving. You need to change the slides.
Okay, I will change now. Can you see if I'm changing?
Yeah, yes, we can.
No,
You have to
keep
come
it
to the
like
slide.
this. Yes, I will change. I will change. So around 75% of the cases, there is a cleft palate component which we may miss if we don't diagnose them in right time. And again, unilateral is around 75%, but the bilateral is around 25%. So we need to pick up those cases properly unless we evaluate in detail. Now, why we are going to evaluate, as I told earlier, is these two are different entities because the origin is different, and they can either come as isolated defects or as a component of either extrafacial defects or component of chromosomal disorders. There are almost 2000 genes which are associated with cleft palate per se if we take into account. And we know the long-term outcome and even the short-term outcome. That means at the time of birth, the effect on the family as a surprise will have a huge impact. And that's why we need to evaluate them properly. If you look at the incidence of associated chromosomal problem, the median clefts are more commonly associated with holoprosencephaly, whereas bilateral conditions have more common genetic incidence around 30%. But nonetheless, even the unilateral cleft lip and palate, around 15% of them can have genetic disease, and hence we need to diagnose them in right time and pick up the genetic component also. Now, if we look at the image, this is an image of quite long back article, but it has shown a various permutation combination of the cleft lip and cleft palate can go hand in hand. So it is not just that we can say, it is complete or incomplete or it is partial or unilateral. It can come in various combinations, and hence, unless we look into it properly, we may miss them. A Eurofetus study has shown that only 1.4% of the cleft palates may be picked up if not trained properly. Now, the difficulty comes in, the most common is for the cleft palate because cleft lip is the one that we normally don't miss. Ideally, we are not supposed to miss the cleft lip. But cleft palate is the one which has a low display rate. The first and most common problem is there is no satisfactory sonographic indicator for us to pick up that there is a cleft palate. Second is a dome-shaped structure of the palate. It is not a normal 2D structure that we can see on a 2D ultrasound, like right and left side or anterior and posterior side. Because of the dome-shaped structure, we may not pick up the details if we look only from one angle. And that's why we need to look at from 3 planes that I'm going to discuss later on. And the third and last important part is, as the gestation advances, the surrounding osseous structures tend to have an acoustic shadowing effect on the maxilla or the alveolar process that we are looking at. And that's why this acoustic shadowing will kind of help us in missing out this condition if it is there in the fetus. And that's why, and the next and the most common condition that we are coming across now is the maternal obesity. The habitus of the mother is restricting our visualization of various organs. This is one of them that we can look at. Now, the aim of looking at these conditions is to diagnose these details. Why we need all these information is, one thing is to pick them up, but the second is when we want to sit with the family and explain them as what exactly is wrong with the child. Unless we have this information in hand, we cannot give them a proper pictorial outcome as what is the possible look of the baby. That is one decision making factor for the family. And the second and most important component is the role of the maxillofacial or the pediatric surgeons. Unless they know what exactly is wrong with the child, they may not be able to explain to the family what exactly will be their plan of action after birth for the child. And that's why we need to improve the display rate for the palate of the fetus and detect them. Just to summarize the anatomy in brief, the primary and secondary palate have different origins, and hence the visualization is going to be different. If we look here, if you can see the pointer, the middle line, that's the 4 teeth only, they are the primary palate, and hence only that triangle is the primary palate. And that's where the lip formation starts, and the cleft lip will be visualized from anteriorly easily because that's a very easily accessible part. But the secondary palate that we can see in the down figure, that is composed of the hard palate, the soft palate, and the uvula, which starts being formation from the posterior part, that is from the uvula side, and it proceeds anteriorly. Hence, those defects which tend to occur more on the posterior component of the mouth may be missed because they are posteriorly and we don't have very common indicators to look at them. Now, there have been various classifications for us to understand. Nyberg was the one which we have been using, and this is the one that has been recently advised, and it's kind of simple and easy to understand and to explain from the pediatric surgeon point of view also. We can see there have been various numbers given, and depending on the number, the organ, the part which has been affected will be given that particular number. And whenever we say that this particular number has a problem, that is easy for us to explain, and it will have a uniform role to explain from all surgeons' point of view. Now let us look at first trimester. Do we have anything that we can give us clue whether any indirect signs? Because as I told, for cleft palate we have only indirect signs, whereas for cleft lip we have direct visualization or possible. Now, as we are trying to invert the pyramid of care, we are trying to pick up more anomalies in first trimester. Even for cleft lip and palate, we have certain clues in the first trimester. The most common is a coronal view, that is a retronasal triangle that gives us the possibility that this fetus may develop a cleft lip or palate later in the second trimester, which will be visible easily. The second view, that is a premaxillary view, if we get this triangle properly, it definitely rules out the number 2 line, that's the alveolar process. If we see intact, that means we are ruling out cleft palate in this particular fetus. But if we see there is any defect here, we can definitely sit down with the family and explain them the need for early anomaly scan at 16 weeks and explain accordingly what can be the possible consequences. Now, this was a very nice article, and the author is our own Indian Dr. Lakshmi, about the superimposed line. This is quite recent article where she has nicely depicted about these 2 lines of the vomeromaxillary junction. Now we have to make an effort to look at this particular bifid line where we can see that the 2 bones which are formed, one which is formed by the vomerus of the nose, vomer of the nose, and the second by the maxilla. Unless we see these 2 distinct lines, we are sure that we are having cleft palate here. There's a very high possibility that the fetus will develop cleft palate if we see only 1 line here. Like in this image, if we can see, the one on the right side has a single line, whereas on the left side we can see a typical bifid structure. Bifid structure means there are 2 bones, that means the palate is being formed properly. A single line says that there is only vomer present and the palate is not formed. And this view has a very good advantage for us because this is a typical NT scan view. What we can see for measurement of NT and NB is the same plane that we are looking at. So we don't have to invest any additional time for screening for this particular anomaly even in the first trimester. And starting from 12 weeks till 20 weeks, this particular sign. So even in second trimester, this sign will be helpful. But as the gestation advances, we may not be able to pick up this sign very clearly. So starting from 12 weeks, we have to make a point that we look at it and document whether we have seen these two signs or not. Now this is another recent sign which has been given by Professor Robbie Chowri. Again at the first trimester, a maxillary gap that we can see. As we can see in this image, that is the same plane again for the NT scan that we look at, and that's the maxilla that we should be able to see. But if we see any gap there, that again gives us clue, an indirect clue that the palate is going to have a defect and we have to work on it in the second trimester. These are various images of the same maxillary gap that is being seen. Now coming to second trimester, the ICOG has given us a basic nice training module for 20 to 2 planes. And again the ICOG has given that cleft lip assessment is adequate. They have not stressed about cleft palate. So from what Dr. Vidya was pointing out earlier that, if we have missed on cleft palate, from legal point of view, it is not a binding because even international guidelines don't mention that we have to look for cleft palate. But as a sonologist, as a fetal medicine, we make it a point that yes, we look it into it, because if we find cleft lip, we definitely always dig and look whether there is also associated component of cleft palate there. But sometimes the isolated cleft palate may be missed, and that's where we look at the additional detailed facial sonogram of the fetus. Now, as per the basic planes that we know, that the plane 18 and plane 20 that have been given in the course, we know that these are the two planes, that is the coronal plane and the sagittal plane, that give us clue about the possibility of cleft lip and cleft palate. Now, we are looking both lip and palate here. We are discussing both because both have equal prognostic point of view effect. And the three planes that we are going to discuss here so that we don't miss in the diagnosis are coronal plane, sagittal plane and the axial plane. The coronal plane that we are going to look at here are the details here. We're going to look at the tangential plane that is passing through the nose, lips and the chin. Now they are going to give us very clear-cut advantage of the nasal orifices, whether they're symmetrical or not. The nasal tip, is it intact or not? How is the upper lip? Is there any break in the continuity? And how is the chin looking? The intactness of the upper chin definitely rules out cleft lip, is what we have the advantage of coronal plane. As you can see in this image nicely, the black space that we can see between the upper lip and the lower lip, that's the amniotic fluid. This is very important. We have to have adequate amniotic pocket around the organ that we are looking at. Like here also we can see the amniotic fluid component that is there next to the nasal orifices. Because if there is no amniotic fluid pocket, we may not be able to see if there is any dripping of either of the nasal bridges here. Also, this fluid pocket, that is the additional stripe that we have to go for whenever we are looking at the lips. Because if the lips are closed, we may miss on a small thread-like fissure which is there in early first or second trimester also. But this component, if we see the fluid, then definitely we rule out any cleft lip component here. That is an image of a unilateral cleft lip, whereas here we can see it's a bilateral cleft lip. Now the advantage here, we need to diagnose whether it is a bilateral cleft lip or is it a median cleft. Because in bilateral, we can see that the upper lip is divided into 3 parts, whereas in median cleft lip, we tend to miss out on this component and the maxillary process is missing there. But whereas here we can see there are definitely 3 parts that are seen from the upper lip point of view. Now this is an image which is giving different types of, can you see here, it's like a hairline gap there. So if we have not had this fluid component, we may miss have this small cleft lip here. Whereas here we can see it's nicely, very easily visible kind of cleft lip component. So what we need to do is we need to give some time, wait for the fluid component, wait for the fetus, because they tend to yawn, they tend to open the mouth. But we have to have the patience and give few minutes for the fetus to open the mouth for us to have a proper visualization with good amount of amniotic fluid around it. Now that is the image of the median cleft, as I told you. Can you see here there is no median component? The upper lip is divided clearly into only two parts. That's one part, that's second part. Whereas the median component is missing, and that's the median cleft. Now this has a very severe effect because it is never isolated. It tends to have associated anomalies in the fetus in other parts, especially in the CNS, and that's why the evaluation of the rest of the fetus is equally important. Now coming to the sagittal plane that we saw earlier, the single line or the two lines, whether we are able to see superimposed line that we discussed in the first trimester is seen again in the second trimester also. Coming to axial view, now this is a very nice, here we have to have the face directly facing the monitor, the probe of the fetus. Here we can see an intact palate and also the lip is clearly seen to be intact. But if there is any defect, it will be clearly seen here. So in normal aperture, what we see normally is the tooth buds that are being formed and they are equally placed here. But if we don't see, we don't wait for the baby to turn in this particular position and give this particular view, we tend to miss the component where we may have a combined cleft lip and palate which is going in depth of the fetal mouth. So we need to have patience for this particular view for the fetus to show us. Now, equal sign is a novel marker again, which has been recently advised for us that we can have a look at, where the marker for us to give us clue is uvula. Now, this is very important because as I discussed, the secondary palate development starts from uvula. So, if we can point out a proper normal uvula, we tend to can confidently comment that yes, there is no problem in the secondary palate or in the hard palate. Now, this uvula tends to be seen in two different planes. One is transverse plane and another is frontal plane. The transverse plane is the one that we can easily see. That's the method that we can find on any ISOG website or anywhere. But the image is very important because the pharynx has a fluid level. The uvula we can see as an equal sign, that is a two equal lines that are running parallel to each other. If we see these two lines running parallel to each other, we can definitely rule out that there is no cleft palate in that particular fetus. Because if there is any bifid uvula or there is any palate, this sign will be missed, and that is where we can get a clue that yes, we are dealing either with isolated cleft palate or a combined cleft lip and palate depending on the frontal view of the face of the fetus also. So this is another indirect but a very good marker, and this has to be given time. We have to start screening from the transverse section of the fetal head, descend down to the nasopharynx and just tilt the probe for us to have this particular plane. If we get this properly, then we are quite confident that yes, we are not dealing with the cleft palate in the particular fetus. Now, this is very important part. Whenever we come across the report or we are giving report, we have to make sure that we mention these three views with the details that we have found in them. In nose chin view, we should be able to tell whether the defect that we are seeing is unilateral, bilateral or median. The axial view should mention whether it is an isolated cleft lip, a complete or incomplete type, and whether it is combined with cleft palate or not. And the coronal view, we should mention about the extent of the defect. That means how much depth we are looking at here for the defect, for the maxillofacial or the pediatric surgeon to sit down and explain to the family about the possible options. Now, are we going to sit down and just finish that, yes, we have done this? No, that is not adequate. Whenever we see either a cleft lip or palate or combined defect, we have to look for the extrafacial defects in the fetus because they tend to have association. Only that is not adequate. As I told you earlier, the cleft palate itself has association with almost 200 type of genetic mutations. Cleft lip or palate can have association with the trisomy 13 and 18. So have we looked at clenched fist of the fetus? Have we looked at the aorta of the fetus? They will give us possibility of genetic component. Because we are able to operate is not adequate, we need to tell them that this particular defect is isolated. That means there is no genetic reason for this particular defect. And whenever we are doing amniocentesis, instead of going for karyotype, kindly advise a microarray because the deletion duplications will be covered only in the microarray and not in the karyotype. That will give the clue for the family at what exactly they are expecting from this particular fetus. The next component has to be a discussion with the multidisciplinary team. The obstetrician has to understand that the fetus has to deliver in a center where a pediatrician who deals with these kind of defect is ready. Pediatric surgeon is available to operate on the baby, and of course a fetal medicine consultant to cover the rest of the pregnancy, because we know that whenever there is a cleft lip or palate, there is swallowing difficulty in the fetus, and there tends to be a polyhydramnios component coming in the late second or third trimester. Also, there will be some evolving anomalies that we will be able to pick up in the late second or third trimester. So, unless we are dealing with all these components, we will not be able to hand over a healthy, happy baby to the family. And that's why it has to be a component, it has to be a team approach by all the concerned doctors involved in discussing and explaining to the family. So the take-home message here is fetal space is very important, and we have to give equal attention like heart and brain of the fetus. Cleft lip and palate are easily detectable, and hence we should not miss. Few extra minutes if we can spend on screening with the different planes that we discussed, we definitely will be able to pick up these cleft palates also, and a multidisciplinary approach will help in having a better outcome. Thank you all for your patient listening. And sorry for finishing fast, because you may have understood I'm having quite URT. I was not able to talk till yesterday evening. So I tried to cover up and summarize the things as much possible as for me. Thank you all for your patient listening.
Thank you, Dr. Pratna, for accepting our invitation. I would request Dr. Khedkar sir to please give his comments, and then Dr. Jitendra sir also. Sachin sir, can you unmute yourself, please?
Yes. Thank you, Pratna madam, for such a wonderful lecture. Thank you. Just diagnosing a cleft lip and cleft palate, it isn't enough. And for also to have in mind that it is associated with so much of other abnormalities and all those things. So it was a very wonderful lecture. And thank you, madam, for such a nice thing.
Dr. Jitendra sir, do you want
Thank you, sir. Thank you for your
comments, sir?
Preeti, I can't see Jitendra sir in the Zoom meeting.
I was trying to look for him. Okay.
Thank you, Khedkar sir and Jitendra sir, for chairing this session and accepting our invitation. And Pratna, it's an honor to listen to you. Being from Sholapur, I have seen you growing up, and you have beautifully evolved into a fetal medicine consultant. I would definitely give my regards to even Shobha madam.
Yeah, I think it was a wonderful lecture, and really nice photographs. You know, the photographs itself are very self-explanatory. I think congratulations, and Pratna, doctor, it was really a nice presentation. So with this, can we please go to the next session? Can I request Harsha to please share Dr. Pratna, you'll have to stop sharing.
Yes. Lalita ma'am, there's just one information that we need to tell you, that Dr. Renu Mehta madam is not available. So instead, Dr. Sheila ma'am will be speaking. So Harsha will show her slides. So please note that.
Yes.
Yes.
Okay. So we have with us Dr. Lalita Bajaj madam here. Dr. Lalita Bajaj is right now the president of the Aurangabad OBGYN Society, a practicing obstetrician and gynecologist at Gangaviyar Hospital at Shambhajinagar since last 25 years, a past secretary of the Aurangabad Society, an active member who has given talks in many CMEs, and she's especially interested in high-risk obstetrics. Welcome, Dr. Lalita. We also have with us Dr. Krishna Pawar. Dr. Harsha, please. Harsha, please share the slides, dear. Stop share. Yeah. Then we have with us Dr. Krishna Pawar. Dr. Krishna Pawar is the secretary of the OBGYN Society of Parbhani, and he is the consultant at Ashok Hospital at Parbhani. Dr. Prajakta Gurude is the third chairperson for today. Dr. Prajakta is the secretary of the Udgir OBGYN Society at the fortunate enough to meet her at the AMOX conference recently. She's also the director of Maher Maternity Hospital and a Nucleus Test Tube Baby Center, especially interested in infertility and IVF specialist, trained in infert, ultrasound, endoscopy, and colposcopy, and is also the organized secretary of the AMOX Zonal Conference of 2024. She has been an active member for also AMOX as well as FOXI and IMA since last 12 years, and has been the AMOX Public Awareness Committee very active member also in the FOXI infertility. So she has a lot of publications and awards to her credit. And I request all my chairpersons welcome. And can I please request you all to introduce our second speaker of today. Harsha, please continue to share the slides. So as Monica mentioned, Mrs. Renu Mehta was not able to join us today. So Ms. Sheila is the one who is going to take the lecture instead of Renu. Harsha, please share the slides, please. Yeah. So Ms. Sheila Koina is the program director, and can I request one of our chairpersons?
Lalita ma'am, please introduce her.
Introduce her.
Renu Mehta. Sheila Koina. The program director of media. Now I am introducing the second speaker for today's webinar. Dr. Sheila, she is the only, she is not a doctor, she is a Sheila. She is a program director for the Smile Train India. She is a program director with the Smile Train India. She looks after the program in southern part of the India, including Maharashtra. Lead initiative to strengthen the Smile Trains program and extend its reach in region. UNFAO and National Dairy Development Board program manager, and she has enhanced livelihood of resources poor communities by establishing and nurturing strategies partnership, collaborated with the grassroots NGOs and government department, research institute and private sector. This is really a great work they are doing for the cleft lip and cleft palate children. Now I request Sheila to start with her talk.
Thank you so much, Dr. Bajaj. I'll just share my screen. Is my screen visible to all?
Yes, ma'am, visible.
Yes, ma'am.
Yes.
Yeah, we can see it.
Yeah, sure. Thank you. So as we know, we've been talking about it for a long time, and I've, all our speakers before me have said cleft lip and palate is actually a national health problem. And children born with cleft, they struggle to feed, eat, breathe, and speak. And as has been said, 1 in 700 babies around the world is born with a cleft lip and or palate. Now, what is the ideal age for surgery? Ideal age for surgery for a cleft lip is between 3 and 6 months. And for a palate surgery, it is between 9 and 18 months. So what is the challenge that we are facing? The challenge is that hundreds of thousands of children in resource poor countries right across our country, India, they don't have access to life-saving cleft treatment, which they are desperately in need of. How does this affect children, cleft lip and palate? They live, in isolation, in prejudice, in their communities, and they often suffer, more than often they suffer with malnourishment. In fact, children under the age of 5 are twice as likely to be malnourished as children without having a cleft. In addition, they have chronic ear infections, they struggle to speak and express themselves, and this, results in a lifetime of anxiety and depression if not treated timely and in a comprehensive manner. So what is our vision? Smile Train's vision is that there is a world where every person has access to high quality, comprehensive cleft care and is able to live a full and healthy life. What is our solution? We empower local medical professionals with the training, the funding, the resources, so that they are able to provide free cleft surgery and other essential, comprehensive essential care to children in their own communities. We don't want our patients to be traveling very far or going to a camp where, they get a one-off treatment. That is why we want to work with local medical professionals so that our patients get the correct treatment and right close to where they are living. What has been our global impact? We have been, Smile Train has worked now over 25 years all over the world. We are working in 95 plus countries, and 48 of those countries are providing comprehensive cleft care. We have provided over 2 million cleft surgeries for people of all ages since our founding in 1999. We have one goal, and that is to give every child with cleft the opportunity for a full and healthy life. While every 3 minutes it is said that a baby is born with a cleft, every 5 minutes a child receives a life-changing cleft surgery from a Smile Train partner hospital, and we are really proud of that. And as far as global economic impact is concerned, Smile Train surgical program has contributed it is estimated over $69 billion. So Smile Train, what is Smile Train India? Smile Train India is a fully compliant registered entity. We are registered as a not-for-profit organization under Section 8 of the Indian Companies Act. We are registered under the Ministry of Home Affairs under the FCRA, that is the Foreign Contribution Regulation Act. We are an approved NGO on the Darpan platform with the Niti Aayog. We are a registered entity with the Ministry of Corporate Affairs to undertake CSR activities, and we are registered to receive donations under Section 80G of the Income Tax Act. What is our global healthcare model? So what do? We support our treatment partners, that is hospitals, to create an ecosystem where children in need get access to safe, quality cleft care. And in addition to surgery, support for surgery, we support awareness activities. We provide support for safety equipment. We provide opportunities for training, for research, and for patients, in addition to surgery, for comprehensive cleft care, that is speech, nutrition, and orthodontics, we also provide subsidies for their travel and for their meals. So what is it? We provide basically the whole journey that a patient has to undertake. What is comprehensive cleft care? I think Smile Train is committed to treating the whole patient through programs that provide access to important comprehensive cleft care services. So right from starting with diagnosis, that is understanding cleft, we provide support for feeding and nutrition, for surgery, for dental care, for ENT care, for speech services, orthodontics, and counseling and support. This approach is only possible because our model is focused on empowering local professionals and health systems to be available for cleft-affected families every day, all year round. And our teach a person to fish model provides various opportunities for surgeons, for medical teams, as well as the cleft community. Our surgeons get hands-on training. They are able to have exchanges with other partners. For our young and upcoming surgeons, we have fellowships. We have developed a virtual surgery simulator where they are able to learn and practice techniques. We have a division of Smile Train, which is Simulaire, whereby which produces 3D models of cleft lip and palate, where young surgeons again are able to train and learn surgery. For medical teams at hospitals, we provide protocols and guidelines. We give them opportunities and scholarships to attend conferences and workshops. We provide training to our nurses and anesthesia teams, training to team as a whole, for a team cleft, what we call, where a surgeon, the anesthesia, and nurses form the team. So we provide training as a whole team together, as well as all our comprehensive cleft care practitioners, which includes our speech therapists, our orthodontists, our nutritionists. We are able to provide training to all these who are part of the medical team. Coming to the cleft community, we support national cleft associations. We work with ASHA workers and RBSK health workers, providing them training for identification of cleft, for timelines of cleft care, so that they are able to, give this information to the community and are able to refer patients to us. We have a CleftCon each year where the cleft community gets together and are able to exchange their experiences and really learn from each other and provide a platform to grow and excel in life. And along this journey of frontlining cleft care in India, we are really grateful for our collaboration with FOXY, along with whom we have been able to develop the antenatal diagnosis of cleft lip and palate. As I said, we have Simula Medical, which is a division of Smile Train. We have got a Cleft Leadership Center, which is based in Bhagwan Mahavir Jain Hospital in Bangalore, Karnataka. We have a collaboration with the NABH, whereby we are auditing our hospitals, partner hospitals, so that they are up to the highest quality and they provide safe and quality surgical care and to our patients. As well as we are collaborating with the National Health Mission through various MOUs with the Rashtriya Bal Swasthya Karyakram. As I said, RBSK, that is the Rashtriya Bal Swasthya Karyakram, we have partnerships in more than 10 states. We conduct frequent awareness workshops with their field workers regarding counseling, nutrition, and Smile Train support. And RBSK field workers, in turn, they support Smile Train by, referring patients from the outreach and help bridge the gap between the patient and provision of care. We have recently collaborated with the Chemist and Druggist Association of Maharashtra, so that primarily, they are able to create awareness as well as be a medium for patient referral to our partner hospitals in the state. We also work with the Rotary clubs and Lions clubs in various districts and states. We are also proud to have India's first national cleft helpline, which is 1-800-103-8301. And since inception in January 2019, we've received 8,500 and more calls from patients, from families, from other cleft professionals wanting information on where they can be treated, what they should do. There are a lot of calls that come in, that in our ultrasound scan, our child has been diagnosed with a cleft lip and palate. What should we do? So we have a whole team sitting in our office who are able to guide and counsel them for this purpose. And we are proud to say that in this short span of time, over 5,000 and more patients have been connected with treatment centers right across the country. So in India, as you can see at our map, we are located all over the country in every state. We work with over 130 partner hospitals and over 200 and more surgeons. 57 of our partner hospitals are providing at least one or more of the comprehensive care services. And in India, we have provided, over this 25 years that we have been in India, we have provided over 750,000 cleft surgeries. So I think we would all agree and that cleft treatment creates brighter futures. Children are able to go to school, they are able to eat, they are able to speak, and they can really become contributing members of their communities. And I think let us pledge together that, we work together to really create these bright futures for all our children across our country. Thank you so much.
Thank you, Sheila ma'am. I request Prajakta to please give her concluding remarks and followed by Dr. Lalita ma'am.
Ma'am, it was a very wonderful talk, and Smile Train, it is such a nice organization. I think, yeah, it is such a nice NGO. I think we should, everyone should contact in our local communities and make it aware for everyone so that no patient can left untreated. So it is very good initiative, not only surgeries, but in fact, speech therapy and everything they are taking care of. So it's really, really very good initiative. So thank you, Monica ma'am, for making us aware of all these things. Yeah.
Thank you, Prajakta. Lalita ma'am, do you want to speak anything regarding the project?
Yes, this is really very excellent project. Now only cleft lip or cleft palate, you cannot advise termination of the pregnancy even if it is diagnosed. So the baby they are born with the cleft lip and cleft palate. Parents, they are really worried with that. Only with single anomaly, you cannot advise them to terminate the pregnancy. So mother has to continue with the pregnancy. So the treatment and the requirement of all these treatment is really very much needed, and the huge work they are doing, like 130 hospitals they are connected with, and they are giving services. This is really huge work they are doing. I congratulate to them and all the best for their future journey. And thank you very much, Dr. Monica and whole team, for calling us, for inviting us as chairperson for this webinar. Thank you very much.
Thank you, Prajakta, and thank you, Lalita ma'am, for joining us today as chairpersons for the second talk. I would like to thank Smile Train and Science Integra from the bottom of my heart for associate with AMOX as a partner to spread awareness regarding cleft lip and cleft palate. And we have been constantly in touch with you, ma'am. And we have seen Smile Train taking care of not only the babies physically as an operative procedure, but also the emotional support that the parents need, the financial support that has been taken care, and the post-operative rehabilitation, including speech and the feeding difficulties, all the comprehensive care that you provide. And we would be very, very happy if you would spread a word across all the obstetricians across Maharashtra for the same. So we look forward to many more associations, not only in these 36 months. Thank you, Harsha, for being the backbone and the technical support. I'm sorry, but Pratna has left, so we will not be able to take the questions for the first talk. Yes, Dr. Preeti, please.
Yeah,
If you could give
it's a
officially the vote of
fantastic
thanks.
initiative, Monica. Yeah, so I think to end it, yes, I'd like to give the vote of thanks. Thank you, team. Smile. I think you will get a lot of more smiles from every obstetrician as well as the babies and of course the parents. And I think what y'all are doing is it's amazing work. It's really amazing work what y'all are doing, and I wish we can really take this forward, because I know I've had two babies in my this thing who've been born with a cleft lip and one with cleft palate, and the difficulties that the parent had. And yes, that time we had referred them to SRCC center, at Haji Ali, and of course they did a fantastic job. But I know the emotional turmoil that the parents went through, and I think what you guys are doing is something that we just can't keep thanking you all enough. So please keep up the good work. And Monica, you are the rock star for starting these programs and to really take it up to spread the awareness. And I wish all the best to Monica and Supriya both. And yes, thank you for being there. Thank you, Tech Support. Harsha, thank you, Bajaj, for supporting this initiative as a CSR activity. And thank you, everybody. Thank you so much, Kiran Kutkoti sir, Amok's team, for making this happen.
Supriya ma'am, over to you for your final comments and a special shairi at the end, without which we cannot end this webinar.
Supriya shairis have to be there.
And I would also like to tell you that this is the faculty platform, so we can see only 9 people logged in here, but there are more than 250 delegates who have joined us online today.
Wow, that's nice.
So thank you very much to the speakers. Wonderful talk as usual. Both topics very well curated. And big thank you to Monica for, a lot of hard work that she has persistently been putting in this Smile Train series since several, I think, weeks now. So thank you, Monica. Thank you, Preeti. And thanks to once again the Smile Train team, Harsha and Sheila ma'am. Bajaj ma'am, I can see Prajakta, they are all still waiting. Charvi is here. So thanks to all of you. Thanks to Dr. Kurtakoti sir on my personal behalf and on behalf of all the organizers. So बस हंसते रहिए, मुस्कुराते रहिए, स्माइल ट्रेन की भाषा आगे बोलते रहिए, बढ़ाते रहिए. Thank you so much and all the very best.
So much.
Thank you, everyone.
Thank you.
Thank you.
Bye.
Thank you, Monica.